This is week one, assignment number one, elevator speech on the role of the nurse practitioner. My name is Richard Rizzo. I am a psych mental health NP student. Going to answer 4 questions in regards to the role of the nurse practitioner. Question number 1, what is a nurse practitioner? A nurse practitioner is an advanced practice registered nurse and the type of mid-level practitioner. Nurse practitioners are trained to assess patient needs, order and interpret diagnostics, laboratory tests, and diagnose disease, and also formulate and prescribe treatment plans for the patient population. Education of a nurse practitioner is usually a Master's of Science in Nursing. The scope of practice for a nurse practitioner varies from state to state and sometimes even from hospital to hospital, because different hospitals have different protocols in regards to the role of a nurse practitioner. How does a nurse practitioner differ from a physician assistant? An advanced practice registered nurse practitioner is trained according to the nursing model of care, while a physician assistant attends programs that are more in line with the medical school model of patient care. The nurse practitioner has a patient-centered model approach, while a physician assistant adheres to a disease-centered model approach to patient care. How does a nurse practitioner differ from a physician? While doctors and nurse practitioners have many similarities in their role, there are some notable differences. The biggest difference between the two is the amount of time spent on training. While the nurse practitioner have more training than a registered nurse, they receive less training than a doctor. A doctor actually has to go through undergrad 4 years, then they go to medical school, and then they have to enter a residency program that is usually 2 to 4 years in length, and sometimes go to fellowship programs where they can specialize in cardiology, whatever discipline they choose to receive a fellowship in, to be more specialized. Why don't you just become a physician? I do not become a physician because it will be pretty hard to find a residency spot at 48 years old. I'm 48 years old now. I have a family. I do not have the time to adhere to the demands of becoming a physician and also keeping a full-time job to be able to provide for my family. My brother, when he went to medical school, he was in his 30s, and it was hard for him to even find a residency spot. His wife is also a physician. She was in her late 20s, and she had a hard time finding a residency spot. Usually when residency spots are given, they base it on age, which is a factor in giving the residency to the individual seeking to do residency after passing the USMLE. So I don't have the time at this stage of my life to become a physician. Thank you. My name is Richard Rizzo. I am a psych mental health NP student, and I am also a family nurse practitioner. I graduated in 2018. Thank you for taking the time to look at my video, and I look forward to seeing the other videos of the other students. Thank you.